Hello friends, welcome to a new lecture on fontanelles. So what is a fontanelle? Fontanelle is defined as a wide gap between the suture line. The wide gap which is present between the suture line, it is called as fontanelle. So there are two different types of fontanelle mainly. Okay, so if this is the fetal skull, this is the frontal bones, and this is the anterior fontanelle, coronal suture. Now this is present like this, and this is lambdoid suture, posterior fontanelle. So first let us learn about anterior fontanelle. Okay, this anterior fontanelle, it is formed by joining four sutures. What are they? One, it is formed by joining anteriorly frontal suture, posteriorly sagittal suture, on either sides by coronal suture. So it is a diamond shaped which is formed by a joining four different sutures. Okay. The diameters of the anterior fontanelle antero-posteriorly excuse me, antero-posteriorly it is 3 centimeters, and even transverse diameter is 3 centimeters. Both antero-posterior and transverse diameters of the anterior fontanelle is 3 and 3 centimeters. The floor of the anterior fontanelle is formed by a membrane, and it is generally ossified by 18 months after birth. It takes 18 months to ossify. If it fails to ossify by 24 months, then we call it pathological. Okay. Now let us learn the importance of this anterior fontanelle. What is the importance? So the main importance of this anterior fontanelle is, first, on palpating the anterior fontanelle during internal examination, we can find the flexion of the head. Degree of flexion of the head can be found out. And secondly, it will help in molding. So it will help in molding of the head. And the third one is, it remains membranous long after birth. So as a result, it will help to accommodate the brain growth. That is, accommodate the growing brain. So it will accommodate the brain growth. Then this anterior fontanelle, it is depressed in dehydration, and it is elevated whenever there is increased intracranial tension. Whenever there is increased intracranial tension, it is elevated. It is depressed in dehydration. Then, what are the other importance? It is used for collection of blood, is performed through it, and also if we have to do exchange transfusion to the infant, so it is done through this anterior fontanelle. Exchange transfusion, both these are done through it. Okay, for samples for in the infant, whenever we'll have to collect blood, and even exchange transfusion can be done through this. And sixth, cerebrospinal fluid can also be drawn through this anterior fontanelle. Okay, so these are the different importance for anterior fontanelle. Let us learn about the posterior fontanelle. So what is posterior fontanelle formed by? This is the posterior fontanelle. Let me draw the diagram. If this is the skull, frontal bone, this is the anterior fontanelle which is diamond shaped. Okay, now sagittal suture, and now lambdoid suture, and then this is the posterior fontanelle. So if you see, the posterior fontanelle is a triangular shaped. This is posterior fontanelle. So it is triangular shaped. Okay, and it is formed by only 3 sutures. One sagittal suture and 2 lambdoid sutures. sagittal suture anteriorly, on either sides lambdoid suture. So this is formed by these 3 sutures, and if you see the dimensions, it is about 1.2 centimeters and 1.2 centimeters. The floor here is mainly membranous, and if you see at term, the floor becomes bony. Okay, so because the floor here becomes bony, the word fontanelle is just a misnomer here. For this posterior fontanelle, the fontanelle is misnomer. Okay, what is its importance? It is mainly denotes the position of head in relation to maternal pelvis. It denotes the position of head in relation to maternal pelvis. So this is about the posterior fontanelle. So let us learn about one more fontanelle, which is sagittal fontanelle. Okay, this sagittal fontanelle, if you see this, this is the anterior fontanelle, this is the posterior fontanelle, and 2 sutures. Now sagittal fontanelle, it is inconsistent of its presence. It is present only in some individuals. If it is present between in the sagittal suture, and that too between the anterior 2/3 and posterior 1/3. So anterior 2/3 and posterior 1/3, it is present somewhere here. So this is sagittal fontanelle. It is inconsistent. Okay, it is present between anterior 2/3 and posterior 1/3. At the junction of anterior 2/3 and posterior 1/3, this is present. So this is called as sagittal fontanelle. So I think you understood about the fontanelles and their importance. This sagittal fontanelle has no importance, no clinical importance. So I think you guys have understood about the anterior fontanelle, posterior fontanelle, and sagittal fontanelle. So thank you guys for watching my lecture. If you have any doubts, please comment it in the comment section. If you feel something is inadequate, even then comment it in the comment section. Thank you for watching my lectures. Thank you.